Welcome back to my YouTube channel. In today's video, we are going to discuss macroglossia, which is one of the soft tissue disturbance of the tongue. Macroglossia means an abnormally enlarged tongue that protruded beyond the teeth or alveolar ridge while in the resting position. Now coming to the classification of macroglossia. It is classified into two types, true macroglossia and pseudomacroglossia. In pseudomacroglossia, there is no true enlargement of the tongue. However, in some clinical conditions, the tongue may appear enlarged in size. Such clinical conditions include tongue thrusting, poor neuromuscular control, edentulous condition, maxillofacial skeletal deficiency, enlarged adenoids, cyst, tumor, and space infection such as Ludwig's angina. Now we will discuss true macroglossia. In this condition, there is a true enlargement of the tongue associated with several clinical conditions. True macroglossia may be seen in congenital conditions such as Down syndrome, Beckwith-Wiedemann syndrome, Laban syndrome, hemangioma, lymphangioma, and congenital hypothyroidism. It may be associated with endocrine disorders, infections, neoplasm, and metabolic disorders, which we can discuss in detail. First of all, we will discuss endocrine disorders such as hypothyroidism, acromegaly, pituitary gigantism, and myxedema. Next, we will discuss infections and neoplasms. Infections such as tuberculosis, actinomycosis, and infections associated with traumatic injury can cause true macroglossia. Moreover, neoplasms such as lymphangioma, hemangioma, neurofibroma, and granular cell tumor may also be associated with true macroglossia. In addition to that, some metabolic disorders such as amyloidosis and glycogen storage disease are the cause of true macroglossia. Now we will moving on to the clinical features of macroglossia. First and foremost, we can see an abnormally enlarged tongue. The patient may have crenations along the lateral side of the tongue. Moreover, patients may experience speech difficulty, difficulty in chewing, difficulty in swallowing, drooling of saliva, mouth breathing, open bite, mandibular prognathism, snoring, and obstructive sleep problem. These are the main clinical features of macroglossia. Now coming to the management. If the patient does not experience any functional disturbance, no treatment is usually required. However, if the patient condition becomes symptomatic, treatment should be advised based on the underlying causes. For example, in case associated with endocrine disorders, hormonal therapy may be recommended. If inflammation is present, proper medication should be advised. Well, in case related to tumors or cysts, surgical removal may be necessary. In addition to that, conservative management may also be recommended. If the patient experiences speech difficulty, speech therapy can be advised. In patients with mouth breathing or tongue thrusting habit correction should be recommended. In some patients may also present with spacing, open bite, for which orthodontic therapy may be necessary. Furthermore, a surgical management can be considered in severe cases. This includes glossectomy, a surgical procedure performed to reduce the size of the tongue. Thanks for watching this video. I explained this clinical condition clearly with help of images. Please watch and subscribe my YouTube channel.